views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, March 30th. Coming up, we'll learn more about a new program helping hundreds of Bronxites avoid hospitalization from COVID-19. It's called the Monoclonal Antibodies Treatment with Montefiore. Then, a Montefiore Einstein researcher shares a new study proving the need for prioritization of the COVID-19 vaccine for cancer patients. After that, New York State Youth Leadership Council joins us to share more about their free DACA clinics and the new American Dream and Promise Act. And we'll catch up with the BronxWorks homeless outreach team to learn more about their work with homeless individuals a year into the pandemic. So please stick around. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. A new COVID-19 treatment is helping hundreds avoid hospitalization here in the Bronx. It's called the Monoclonal Antibody Program at Montefiore. Joining us now to tell us more about this treatment, who qualifies, and more is Dr. Una Hopkins, Director of Nursing of the Monoclonal Infusion Suite at Montefiore Health System. Welcome, Dr. Hopkins. Thank you so much for joining us today.
Thank you for having me. I appreciate it.
Of course. Before we begin, can you just tell us a little bit about yourself and your work at Montefiore?
So I'm a doctorally prepared nurse practitioner, and because of my history in oncology and the use of monoclonal antibodies in the therapies that I was delivering, I was best suited for the opportunity to bring our monoclonal antibody infusion suite up and make it running as efficiently as it is today.
Thank you, Dr. Hopkins. Really important work you're doing. What exactly are monoclonal antibodies? For those folks tuning in, we're a little jarred by the name.
So monoclonal antibodies have been around for a long time. We've used them in our oncologic ways to treat patients for a long time. But basically what they are is they're man-made proteins that act like human antibodies in the immune system. They mimic the immune system's ability to attack an antigen. And that's what the COVID-19 virus is. In the COVID-19 virus, it has a spike protein on it called ACE2. And our monoclonal antibodies attach to it and therefore decrease its ability to replicate in our body with the hopes that it will decrease symptomatology that the patient experiences.
Got it. Now, Dr. Hopkins, you have the monoclonal antibody therapy treatment over at Montefiore. When did Montefiore start this program, and how many patients has it helped so far?
So it is under emergency authorization use by FDA. The combinations, there's several. There's a combination by Eli Lilly and there's a combination by Regeneron. We started to use the combination and monotherapy in December 2nd, shortly after they were approved. And to date, we've treated well over 800 patients.
And how exactly are the antibodies given? What is the process like? Is it painful at all?
So it's an intravenous infusion. It's given over about 20 minutes with a 1-hour observation period shortly there, immediately following the completion of the infusion. It's not painful other than the prick that you feel for the needle to go into your arm to get the IV access. But other than that, no, it's not painful.
Got it. And who exactly qualifies for this treatment? Which are the eligible high-risk conditions that qualify for the treatment?
So under emergency authorization use, you have to be COVID positive. You can be COVID positive by PCR test or by rapid antibody test. And you also have to be demonstrating symptoms within 3 to 10 days. So it's the treatments in the clinical trials were shown to be much more beneficial if it was given earlier in symptomatology. And the patients that are at high risk are those that are obese or having a BMI greater than 35, have any kind of chronic kidney disease, have any kind of diabetes, anything that's immunocompromising, such as the treatment for undergoing for an oncologic condition or a transplant of any kind, whether it's kidney or liver or lung. You can be over 65 years old or over 55 with hypertension. And you do not need all of these. You just need one of those high-risk factors. So you need a positive COVID test. You need to be within 3 to 10 days of symptom onset and have one of those symptoms that I just mentioned above.
Dr. Hopkins, why is it important to provide this alternative here in the Bronx in particular?
Well, the Bronx, as you know, has been a very, very hard hit borough for COVID-19. And our patient population has succumbed and had great losses from COVID-19. So therefore, if we can administer a therapy to someone within 3 to 10 days of symptom onset and keep them out of the hospital, they have a much better survival rate. And looking at our own personal data here at Montefiore, we've been able to maintain a hospitalization rate of anywhere between 5 and 10%, depending on which month, which means that we're keeping over 90% of those patients out of the hospital.
And is this therapy treatment an alternative to the vaccination, doctor, or is it something as well as a vaccination? Can you clarify a little bit on that?
What a great, important question. If you have the opportunity to take monoclonal antibodies and you do so, you don't take the vaccine for 90 days. That doesn't mean that you shouldn't be vaccinated, but you can't or should not be vaccinated for at least 90 days post your monoclonal antibody infusion. We give our patients a very specific card, if you can see what I'm holding up here, and it basically goes and tells you the date that you had your monoclonal antibody infusion. And that is to help our healthcare providers know that you should not have vaccine until 90 days following that date, because they compete. And you don't want competition in your body, because if the monoclonal antibodies are helping you mount that defense, then you don't want vaccine, which is also going to help you mount a defense.
Okay. So does the patient have a choice whether or not they want to get the vaccine or the monoclonal antibody treatment, doctor? Is that something that they should decide?
Yeah, they do have a choice. So in our screening process, and it's multidisciplinary, so we have physicians, we have infectious disease physicians, we have nurses, and we have pharmacists, all screening patients. So if they've already received maybe one of their 2-dose vaccine regimen and they have symptoms that are likely to progress, then we do advise them to get the monoclonal antibodies. If their symptoms are very mild, such as a mild headache or mild nausea, and they don't progress within that 3 to 10 day, we encourage them to stay on their vaccine regimen. So if they're due for it in a week or 2 weeks or whatever. But it really is very important to make that assessment from a clinical person to help that patient make that decision, because it is their decision.
Right, absolutely. Are there any allergic reactions or symptoms that we should worry about when it comes to this treatment?
Well, we haven't seen too many allergic reactions at all. Actually, none that have been serious enough to send somebody to the hospital from the infusion center. We've seen mild symptoms such as nausea, which we can take care of with a medication, or slight fever, which happens to be managed with some Tylenol. So for the most part, no. And our patients are feeling much better. We give them a call about 24 hours after their infusion, and to make sure that they are continuing that progression of feeling better and that their symptoms have not gotten any worse.
Dr. Hopkins recently had a success story with a 7-year-old patient named Irma Vega from the Bronx. Can you tell us a little bit about her case and, about the success story with the monoclonal antibody treatment?
So it's really important to know that, there are a lot of success stories here. We have well over 800 success stories. But the bottom line is each individual patient is treated as an individual. And she was just so happy because she was not on a vaccine list. She hadn't been able to get herself onto one of those lists, but to make sure that she could feel better and not get worse and be hospitalized, I think was really, really important to her and important to the rest of us, obviously, because that's what we want to do. We want to keep patients out of the hospital.
Now, without further ado, how can people find out more about this treatment and get in touch with Montefiore? Is this something that's a process with a primary care physician, or how can people get in touch?
Your physician or your city MD or an urgent care, anyone, if you're inside the Montefiore system, we have a HIPAA compliant email. It's called covidasp@montefiore.org. That's if you're in the Montefiore system. We also have an externally facing self-referral ability, and that is COVID antibodies at montefiore.org. COVIDantibodies at montefiore.org. And that is for those that are external, such as our city MDs and or patients with family members. Sometimes the one family member will test positive before another, and they'll come in. And again, it's most advantageous to take the monoclonal antibodies in the early onset of infection.
Got it. Before we go, Dr. Hopkins, just a quick message to the community in the Bronx about, taking the right treatment and seeking the right help with, especially with preventative care. A lot of folks are afraid to go to their doctor nowadays, through COVID-19. Just a little message for the Bronx community.
Oh no, you should absolutely take care of yourself, whether it's hypertension and or diabetes or obesity, anything that requires any kind of health attention, you should continue to go, because there's lots of options now. They can do telemedicine with you, or they can do a telephone call, and they can get some symptomatology from you and understand whether you actually need to come in or not. And of course, screenings are absolutely of most importance. So whether it's a breast mammogram and or a colonoscopy, all of those are very, very important preventative opportunities for one patient to continue to do.
Yes, I'm glad you brought up colonoscopies, doctor. March is Colon Cancer Awareness Month, so it's super important for people to get that preventative care out of the way as well, no? And things are safe. Things are safe at Montefiore, always.
Yes, they are.
Thank you so much, Dr. Una Hopkins, Director of Nursing for Monoclonal Infusion Suite at Montefiore Health System, for joining us today.
Thank you.
Of course. We'll be right back here on Open BXRx.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people. Avoid crowds. Stay home if you can. Wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. A new study by Montefiore Einstein finds that the majority of cancer patients with COVID-19 have similar immune responses to people without cancer. And now specialists are saying that these patients should be prioritized for COVID-19 vaccinations. Joining us now to share these findings and more is Montefiore Hematology Oncology Fellow, Dr. Asta Takhar. Welcome, doctor. Thank you so much for joining us today.
Thank you for having me.
Of course. So first, Montefiore Einstein recently published a new study finding that most people with cancer should be prioritized for COVID-19 vaccinations. Can you tell us about this study and your findings?
Of course. So our health system, Montefiore Einstein, was one of the first places in New York City which was hit with the first surge of COVID-19 cases back in spring of 2020. And we were seeing a lot of patients who were coming in with the COVID-19 disease. And as an oncology fellow in training, myself and my colleagues, we were wondering how our patients are going to respond to this virus, because many of them get immunosuppressive therapy as part of their cancer treatment. So we wanted to study the immune response after COVID-19 infection in this patient population. And so we collected data on 261 patients with cancer who underwent antibody testing at Montefiore for COVID-19, and we found that majority, which is like 92% of our patients, were able to develop an antibody response to COVID-19, which is very comparable to the general population, i.e. someone without cancer. So that is, the major finding from our study.
Wow.
And sorry.
No, it's okay. So Dr. New York is currently vaccinating phase 1A and phase 1B groups. As we know, people with comorbidities over the age of 16 qualify under this phase in particular. Are COVID-19 vaccines currently available for all patients with any type of cancer? Is that something that's happening now?
That is correct. So any patient, as you said, above the age of 16 who has a current or previous diagnosis of cancer. So even if someone has been treated for a cancer 5 years ago, 10 years ago, they qualify to get the COVID-19 vaccine. And the results from our study, support that patients with cancer are able to produce or develop a very good antibody response to the infection. So we are hopeful that with vaccination, we would see similar responses.
Got it. And I think something floating around is a concern, doctor, that some cancer patients currently undergoing treatment should or should not avoid getting the vaccine. What is the consensus here? Should people undergoing cancer treatments avoid the vaccine, or is that not going to be an issue?
That's a great question. And to answer this, we specifically looked at prior cancer therapies and their association with antibody responses in our patient population in our study. And we found that while majority of the solid tumor patients, like for example, breast cancer or lung cancer or prostate cancer, those patients had about a 95% antibody positivity rate. So 95% of them developed antibodies. However, in the subgroup of patients with blood cancers or hematologic malignancies like leukemias, lymphomas, or multiple myeloma, they had a lower antibody production rate, which was about 82%. So we identified this specific group of cancers which had a lower seroconversion, as we call, of the COVID antibodies. And specifically, we found that patients who had received anti-CD20 antibody treatment or stem cell transplant had a lower rate of positive antibody as well. So while it appears, the majority of majority of the patients who were receiving anti-cancer therapies were able to mount a good immune response, delaying vaccination or delaying treatment is something we think is still should be very individualized to each patient and be discussed with their oncologist about when they make a treatment plan.
Got it, doctor. Thank you so much for clarifying that. So it's definitely depending on the type of cancer that you've had to fight and the type of treatments that you've undergone, correct, doctor? Just to emphasize that.
Correct. Yes.
Got it. Another thing that we know is that 3 COVID-19 vaccinations have received emergency use authorization from the U.S. Food and Drug Administration. As we know, the Pfizer, Moderna, and Johnson & Johnson are the 3 types of vaccines. Should people with cancer get a specific COVID-19 vaccine? Is one preferred over the other?
In all of these 3 vaccine trials, patients with cancer were excluded. So we don't have any direct comparative data. But as health officials and experts say, you should get the first vaccine you can. So I think in terms of their efficacy, they vary between like 70 to 95% based on which brand. But we still recommend that you should get a vaccine, and we unfortunately don't have any direct post-vaccine data yet.
Got it. Okay. I think we spoke a little bit about this topic, but are COVID-19 vaccine efficacy rates affected by any cancer treatments as well?
Again, there is no direct data because as vaccinations are just being rolled out, we will continue to learn more as more and more patients get vaccinated. But it seems that from the infection, like immune response from the infection was affected by patients who received, say, anti-CD20 antibody therapy or stem cell transplant. In these particular patient populations, there was a lower rate of positive antibody lower rate of positive antibodies. Okay. Patients who had received endocrine therapy, on the other hand, had a very high rate of positive antibodies. And patients who had received immunotherapy in our study, had 100% positive antibody rate. So while we will still continue to learn more about vaccines and their efficacy in this particular patient population, what our study tells us is that majority of our patients post-infection were able to mount a good immune response to the infection. And we are hoping to, that this data will extrapolate into a post-vaccine immune response as well.
Got it. Do we know anything about projected safety of the COVID-19 vaccine for cancer patients, doctor? Anything that you can share in that regard? A lot of people are worried about getting it, depending on their immune response as well.
Right. Well, it seemed, again, like patients with cancer were excluded from these clinical trials, so it's very difficult to make direct conclusions. However, this is something we are aiming to study in future. So we are trying to collect data and study the adverse effects of patients who are specifically going to get immunotherapy and the COVID-19 vaccine, and to see if they experience any serious side effects.
Got it. Doctor, something we spoke about earlier with Montefiore was about monoclonal antibodies. Is that something that cancer patients qualify for at this point, besides the vaccine?
Yes. Monoclonal antibodies are, for mild infection not requiring hospitalization. Our patients do qualify for that, and we are able to administer it to our patients at Montefiore.
Got it. Thank you so much for your time. Before we go, doctor, how can people get in touch with Montefiore and find out more and inquire about just getting the COVID-19 vaccine moving forward?
Of course. So the best way to get in touch with Montefiore is through the website, www.montefiore.org, or our Twitter handle at Montefiore NYC, or I could call the phone number 1-8444-442819 and receive information about vaccination at Montefiore.
Got it. One more time. Just one more thing before we go also, just about prevention and the importance of preventative care and attending these, your appointments with your doctors, especially when it comes to oncology and following up with cancer treatments. Could you just share a few messages of encouragement for patients?
Of course. Yeah, so we observed in our study, actually, we looked at this. We observed that patients who had solid cancers, as I said, breast, lung, prostate, or colon cancer, they shed the virus. If someone had tested positive for COVID-19, they remained positive for a mean of 30 days. And patients who had blood cancers like leukemias and lymphomas, if they had tested positive for COVID-19, their PCR remained positive for like 60 days. So in addition to identifying patients who had high antibody response rates with some caveats in some low antibody response groups, we also identified that patients with hematologic malignancies tend to shed the virus for a significantly longer period of time. So this also tells us that even though vaccinations are being rolled out, we need to mask up and take all precautions, wash our hands frequently to keep preventing the spread of COVID-19. And this collectively, our findings, we are able to conclude that specifically in patients with blood cancers or hematologic malignancies, they require like very close surveillance and follow-up to make sure that, say, after an infection, if they're able to develop antibodies, and how long they are remaining positive for the SARS-CoV-2 virus, to be able to protect other members of the community.
Dr. Asta Takhar is a Montefiore Hematology Oncology Fellow. Thank you so much for joining us again today. We'll be back here on Open.
Thank you.
Welcome back. The House of Representatives recently passed the American Dream and Promise Act, a sweeping measure which provides a pathway to citizenship for undocumented children known as Dreamers. The New York State Youth Leadership Council provides free DACA information, resources, and clinics to those seeking DACA. Joining us now to share more about the new act and more is Israel Sanchez Leon, community organizer at NYSYLC, the New York State Youth Leadership Council. Welcome, Israel. Thank you so much for joining us today.
No, thank you for having us.
Of course. So first to start, for those who are not familiar, can you tell us about NYSYLC and your mission?
Yeah, it stands for the New York State Youth Leadership Council. We usually call it the YLC for short, since it's a mouthful, but we are a women-led, queer-led, undocumented youth-led organization. We try to give undocumented youth in general, the tools to create the change they want to see in their society, in their communities, through grassroots organizing, through leadership development, through educational advancement, self-expression. And I think one of the things that's special about our organization is that although we are a nonprofit that's seeking to create change in certain social issues, we go about it in a way that's different from a lot of other spaces. You know, we value the humanity of everyone. We try to put importance on other things that people don't, like self-expression, arts, people's well-being. So we try to move away from the framework that a lot of nonprofits have.
I love that. Thank you so much for sharing. And how has the organization continued to mobilize and provide resources and services to undocumented folks throughout the pandemic in particular?
Yeah, it's a really interesting question because I actually came on March of last year, and it was right around the time where the pandemic was causing the shutdowns. Wow. So my role, which as community organizer, was completely meant to be outside, going to events, going to rallies, meeting people, et cetera, had to be completely shifted online. And so did all the work our organization does. It was hard to learn how to do organizing through Zoom. It's challenging when people don't have that one-on-one, way to communicate. But it's also challenging just because so many of our membership and the communities we're trying to help were directly impacted by the pandemic, by all these social issues that already exist. So it was really tough. And one of the things people forget is we ourselves are directly impacted. So we're going through our own things as well. So we shifted to Zoom events, obviously. We try to do game nights. We try to do organizing on Zoom, educational webinars. And we also set up a lot of things to help our communities. One of the things we saw right away was that the state and the federal government wasn't going to do what they needed to help undocumented communities. So we set up a fund to help undocumented families. We raised thousands of dollars that we helped distribute to so many families. Even that was not enough, though. Amidst the protest of the Black Lives Matter movement, all the killings of Black people by the carceral state, we decided to shift some of those funds to just Black families, undocumented Black families. And, we've been doing our best to not only provide space for people to organize at our nonprofit, but also to check on their mental health, to do things that aren't offered in other spaces. And, it's been a tough transition, but we're doing our best while also balancing our own needs and our own ways that we've been impacted.
Wow. So you started at the height of the pandemic, and that was a huge transition for you and the families as well. But thank you for sharing. It was definitely an understatement for me to ask how the work has continued, but you have continued it, and thank you for that. Israel, I also wanted to ask about a demonstration against deportation and ICE collaborations with New York. Can you tell us more about these demonstrations and what exactly took place there?
Yeah, this was last weekend now at this point. But basically, we're a part of a coalition, the New York, New Jersey Abolish ICE Coalition. It's a bunch of other nonprofits, individuals that are coming together to work towards ending ICE contracts, ICE detention in New York and New Jersey, calling on no further deportations, no further detention. So we've been doing a lot of work behind the scenes, helping community members, helping people that are detained, working on legislation. But we wanted to show physical support for the people that are being detained and call on Biden to end and abolish ICE on New Jersey and New York, to end ICE contracts. So our focus was a rally, and we went there, we showed up in person, we chanted, we spoke about our experiences. But one of the most important aspects of the event, I think, was having people that were directly impacted. We had people that were recently released there speaking about their experience in ICE. We truly believe that no one is better to tell the story in any issue than the people who are directly impacted. On top of that, we had people call in who are still currently being detained, family members of people who are being detained. And I think it's one of the things that often gets lost in these conversations is that these are real people. And these, the criminalization aspect often makes people outside watching forget the humanity of the people who are being impacted. So we truly are trying to do this through an abolitionist lens. We don't think anyone should be incarcerated. So we were pushing for that, and we were calling on, the end of all that through rally, through protest, through arts, through chants, through being there in community. So that was very important for us to do last week. And we continue to do the work, off the ground as well.
Right. And one of those pieces of legislation introduced recently was actually the American Dream and Promise Act. What will the act provide for young immigrants? How does the YLC feel about it?
Yeah, as an organization, we definitely have mixed emotions about it. Personally, myself too. It would give a pathway to legal permanent residency to millions of undocumented youth, not only people with DACA or the people that are often referred to as dreamers, but also people with TPS that qualified for it. I think as of January 1st of 2017. It is a good bill. We do hope that it passes, but there are a lot of aspects that we don't like about it, particularly the criminal bars that are in place. So a lot of the things that people don't realize about this bill that's different from even DREAM Acts that were passed before is that there's a second round of processing conducted by DHS, which gives DHS a lot of discrepancy in denying people based on misdemeanor convictions, juvenile convictions as well, I think. So like if you went to juvie, you might be denied by the DHS officers that's processing your case, or if you're affiliated by a gang with no actual conviction of that. So what we see often in these situations is that these things are done in a way that's racially motivated. So there's a reason why these things were implemented in there, which is to appease to the white supremacists, Republicans, the people that don't want certain people here. And it gives DHS a lot of discrepancy to deny people in that second round. It will provide a pathway to permanent residency and citizenship for a lot of people, but we're worried about what those criminal bars are going to do, and quote unquote criminal bars. Misdemeanors, people often forget, are things you get convicted for that will be less than 12 months in jail. And, that's a lot of people. A lot of people make mistakes when they're young. A lot of people go to juvie for doing stupid things. I don't think that's a reason to deny people their rights. And secondly, this whole gang member affiliation, who decides that? If I end up in a photo with someone who's a quote unquote gang member, then I could be affiliated in that way and be, denied. So those are dangerous provisions. A lot of people are fighting to get those removed. Of course, if the bill passes, it will provide a lot of relief for some people, but it doesn't go nearly far enough. And, we're going to continue to fight even if it does pass.
Thank you for sharing, Israel, a little bit more about that. Something that the YLC also offers is free DACA clinics. Who qualifies for these free DACA clinics, and when and how are they being held?
Yeah, we actually, one of the things that's interesting about our organization is we're not actually a service providing organization, which means we don't usually help people file DACA. We don't usually provide the relief that we were giving last year in terms of monetary payments, but we try to respond the best to the moment. And, we realize we're in a pandemic. We realize that DACA faced a lot of challenges in the court last year, and a lot of new people may qualify even without this new legislation passing. So we're planning to have one on April 10th. A lot of people have already been signed up and pre-screened, which means the organization that's helping us, NYSYLC, calls and interviews them and sees if they qualify for the relief, because obviously DACA is not all-encompassing. But a lot of people were able to sign up. We're still figuring out, because I don't think we're fully done yet with that. But if you need more information, you saw the email on the screen, you can email us as well. It's basically open to anyone who wants a legal screening to see if they qualify. I know a lot of people that didn't apply the first time before it was, it's been in court since the last administration. So please give us a call, reach out via Instagram, reach out via Twitter. We'll do our best to respond as quickly as possible. And if we can provide the help that day of, we can definitely refer you to someone who might.
Thank you for that, Israel. Before we go, I wanted to talk a little bit more about intersectionality and solidarity with the movement and with folks, who are undocumented and who need our support, especially, our brothers and sisters here in the Bronx that we grew up with. Can you just talk to us about just the importance of that and empathizing with those, even though your situation may be different?
Yeah, it's a lot of ways to show up for people, Rallies, protests aren't the only ways. There's a lot of community work being done behind the scenes. The coalition that I'm a part of does a lot of that work. You know, there's ways to support our organization through other means. It doesn't have to be through organizing or policy work. We have education teams, we have dream teams, which help students in high schools and colleges who are undocumented navigate systems that aren't meant for them. We have a lot of programming that's done for fun and self-expression, even in this online world that we're adapting to. And even just providing monetary support. You know, the thing that keeps our organization running is that as well. So any ways that you can show up for your community is more than appreciated. You know, I think it's important to understand how a lot of these things are linked. You know, it's not a surprise that in the midst of a pandemic, we saw just how fragile and just how broken our system was, you know. And we forget that it's meant to be this way as well. So, you know, capitalism, white supremacy, all these isms are working together to create these barriers for certain people. You know, it's the carceral state both affects Black people being murdered and causes that, and also causes the criminalization, deportation of immigrants, which is also a Black issue, which often people forget, you know? So there's a lot of the isms at work here, patriarchy, white supremacy, and we're doing our best and trying to be part of a movement that does that. So in any way you can get involved in your local communities, I think it's the most important way. Mutual aid networks, local community fridges, just these small things, these small ways to show up for people eventually make a bigger difference. And I think that's important. You know, there's a lot of ways to be involved. There's not one right way. I think the first good step to take is to educate yourself on these issues, learn more about the people doing the work, who's leading that work, what is it actually trying to accomplish, and getting involved.
Right. Thank you, Israel. Before we go, just how can people stay in touch with YLC and learn more? Any websites or Instagram handles and all that good stuff that we can stay connected?
Yes, the great thing about our organization is it's a very unique name. So all our handles, all our websites are the same, NYSYLC. If you Google us, look us up on Twitter, Instagram, please follow us. We're always trying to raise that number because it helps us reach more people and it helps our impact. Tune into our Instagram lives, tune into all the work that we do. There's a lot of great work being done. I know it doesn't seem this way right now, but we are a women-led organization. And you know, it's important for us to support the work that we're doing. So thank you. And yeah, you can find us through that handle.
Thank you. Thank you again for your time today, Israel.
Thank you. Have a great one.
Israel Sanchez Leon is a community organizer at New York State Youth Leadership Council. You can stay in touch on the handles that he provided. We'll be right back. We're taking a quick break here on Open BXRx. Welcome back. BronxWorks Homeless Outreach Team, or HOT, is a mobile unit that works with homeless individuals on the streets 24 hours a day, 365 days a year. And their work has not stopped a year into the COVID-19 pandemic. Joining us now to share more, our HOT Program Director, Juan P. Rivera, Clinical Coordinator Sarah Zamilio, and Outreach Coordinator Isa Acedo. Welcome all. Thank you so much for joining us today.
Thank you for having us.
I'm happy to be here.
So first, to start out, for folks that don't know, I gave a little bit of an intro for BronxWorks Hot Team, but you can give us a little bit more. Can you tell us about the Hot Team and your mission?
Sure. So the BronxWorks Homeless Outreach Team is a 24-hour outreach team. We're contracted by the city. And we've been doing the work here in the Bronx for many years, probably about 20 years or so. And, our goal, our mission is to reduce and hopefully one day eliminate street homelessness. And we do that, sort of with different strategies that we've been using for many years that have been successful. And what we try to do is we use our 24-hour outreach team that does the canvassing on the street to really identify the folks that are out there who may need assistance. And we try to focus on the most vulnerable individuals and try to get them inside using our resources that we have. We have several options for transitional living that we can put folks into to kind of get them, under a roof and start working with us on things that perhaps they haven't, worked on in a while, like their health, whether physical or mental health, and getting them sort of, working in that process of eventually getting into permanent housing. That's the goal. And we use a case management team to kind of support folks, once they come in. And, that's sort of our strategy. We kind of divide the work up. We have an outreach team that does the canvassing and identifying and really, being out there in the community. And then the case management staff really sort of works one-on-one with the individuals to get them, whatever they need. It's ultimately it's about housing, but we do a lot of different things along the way, obviously. And that's really worked for us. It's a sort of, a tried and tested method, and it's worked really well for the folks here in the Bronx that we serve.
Thank you, Juan. Thank you for that. And how has the Hot Team continued to work and respond to needs, especially during the pandemic throughout this entire year?
Yeah, so we've transitioned a lot more seamlessly than one would think. Most of our work really is very quick, on the fly, and so we're pretty accustomed to having to adapt very quickly to things. And so, some of the main things that we've really done to adjust to the pandemic, I would say one of the biggest ones is changing staffing schedules so that we have staff kind of in a scattered manner, which really has worked out for us because now we have staff working later in the night and we can catch some of our more difficult to find clients, street clients. And, another big thing we've done is transition our psych services to telehealth, and we've been able to reach a lot more people. We're able to bring phones and tablets down, under bridges, into street locations, and access people that really we haven't historically been able to access that well in terms of like bringing into the office and getting mental health services. So that's really been a huge change. And, we're just working with different providers right now to try to get vaccines and testing available to our clients. It's really difficult to reach a lot of our clients. So we're trying to work through a couple different avenues to make that accessible. And then we're having a supply really of sanitizer and masks that Isa's team has out in the street pretty much at all times, handing them out to clients. So I would say those are the biggest changes that we've had to adapt to.
So there's definitely, a big silver lining throughout the pandemic, and your work has not stopped, as I said, so thank you all, for your work and continuing this important work in our borough. And although the weather is becoming warmer nowadays, we had a really, really long winter and it's been really frigid out there. We're still facing fluctuating cold temperatures even now. How does the team prepare for these frigid nights? And, I know that you have code blues and code reds. Could you help us define these and tell us how you work through the frigid temperatures?
Yes. So the code blue is the initiative where, when it's under 32 degrees, we have a list that we prepare for our most vulnerable clients that we know are in the street. And so we focus on making sure that we check on these vulnerable clients during the code blue whenever it's below 32. And the code red is when it's like really, really hot and it's a heat wave, and we continue to focus on them same vulnerable clients. And we make sure that we see them in a certain time period to make sure that they're not freezing to death when it's a code blue. And overheating or like catching strokes and stuff in the heat and like when it's a heat wave. So, you know, we all know that March is a tricky month. It's 70 degrees one day, it's 32 degrees the next day. So we just continue to visit these clients and let them know that even though it's 70 degrees today, the temperature might drop at night. And we try to convince them to come in. A lot of the clients that we do encounter in the streets, some of them already have beds. So whenever it's cold or whenever it's hot, we can take them to their certain bed that they at, where it's either AC or it's somewhere warm during the cold blue. We also have something, a warming center in the Bronx that we also can take people to so they can keep warm during really frigid temperatures and stuff like that. So we just keep, you know, engaging people and meeting with people and checking on them as well, no matter what the weather is.
And always planning ahead. Thank you for that, Isa. There's something going around about the homeless being more susceptible to the coronavirus. Is this true? And how's the BronxWorks hot team addressing the contributing factors to the virus and, you know, homelessness?
I don't know that it's necessarily true that the population is any more susceptible than, you know, maybe the general population. I mean, I think I'm talking about really the street folks. I mean, the people who are on the street, I think for them, it's more about, you know, education and making sure that, you know, we're getting PPE and things that they might need on the street. You know, where a person who's street homeless may not have access to a lot of information, you know, versus somebody who's inside and may have access to a TV or to the internet. I think, you know, in terms of the folks that are inside, like, for example, at our drop-in center or, you know, in any one of our settings where we have beds or rooms, you know, we have done a lot of work to make sure we're in compliance with CDC regulations in terms of spacing and just making sure that folks are not, you know, on top of each other and that we're testing and that we're doing the things that we need to do to prevent any potential, you know, spread or you know, and we've been, you know, really fortunate. We have not had any kind of outbreak or any kind of serious issue like that amongst the population that we worked with inside. On the street, we also haven't sort of seen that spread that we thought maybe initially when all of this happened that we thought might happen.
Yeah, and to just mention that when the outreach team is out, we also have PPE in the vehicles. So we also supply clients with masks, hand sanitizer if they need it and stuff like that. And then we also ask questions about, you know, if they have a fever, stuff like that. You know, health questions as far as like surrounding coronavirus and stuff like that.
Got it. Something that Sarah brought up is vaccination and getting people access to the vaccine. Is that something that New York should prioritize, getting the homeless population access to the vaccine as well on the priority list?
I mean, I think that anyone who is vulnerable, whether they're homeless, street homeless or not, should be prioritized for vaccines. So, you know, we've been able to set up folks with some of the vaccine sites that are already open. We've had some success there, and you know, our medical director actually recently got access to the Johnson & Johnson vaccine. So we've been doing that here at the drop-in center recently, and that's been successful. And you know, the Johnson & Johnson is one shot, which is great because you know you just have to get the person there one time. Versus the other ones where you might get the person there the first time, but if you're talking about a street homeless individual, you might not find them the second time around, or there's a time period of 2 weeks, 3 weeks, whatever it is. So you know, we've been fortunate there, but yeah, I mean, everyone who's vulnerable should be prioritized. So you know, we continue to sort of make sure that our folks are on that list and that we can get them the vaccine if they want it.
Absolutely. And I think we kind of talked about this a little bit earlier with the COVID question, but I did want to bring up that one study showed that the COVID-19 mortality rate of sheltered homeless people in New York was 75% higher than the city's entire rate. There is no note of unsheltered homeless mortality rates. Is there a challenge or disparity of counts for this population in particular?
I mean, we can only speak for what happens in the Bronx in terms of our street population. I mean, I think, we have been here, the three of us, the entire year that this pandemic has gone on. And, I can honestly say that we haven't seen an increase or a large increase in mortality rate based on COVID. And I think if you look at the annual report on deaths of street homeless individuals or persons who are experiencing homelessness, the last report for 2020, we had 2 people that passed away on the street who were identified as homeless. So I think, that speaks to, low mortality rate or basically us kind of doing what we do in terms of identifying vulnerable folks and making sure that we're addressing, whoever's out there. But yeah, I mean, overall, I can't say that we've seen this increase in mortality based on COVID.
Got it. I wanted to ask also, there's something else. According to the IRS, people experiencing homelessness may be eligible for a $1,200 economic impact payment. Is this true? Is this something that BronxWorks Hot Team has been able to identify?
Yeah, so we have case managers. Part of our team is about 12 case managers who work with clients on housing. And so they also help with a lot of other things. And they have been able to secure some of those payments for our street clients, as well as our clients in transitional sites. And for those who have not, we've now, because it's tax season, we're actually setting up appointments for clients who want to kind of backtrack that payment and try to get it in their taxes. And so we've been bringing people in actually through BronxWorks. We have a free tax preparation program every year during the season. And so we've been bringing clients in to get it that way. And that's, so far we've had some success. I think, where our barriers come in as far as setting something up like this for our clients is really, when it comes to not having a stable address, you can't have the IRS send the check to mail it to you. When you don't necessarily have a lot of financial literacy, you may not have a bank account for that direct deposit to come in. So we're always trying to, wrangle with those kind of challenges.
Well, that is incredible news. And, thank you for sharing that, Sarah. I wish we had more time, but we have to go. We are running out of time. But I did want to share folks how can they support the BronxWorks Hot Team and reach out to contact you for more information, as well as, help out when they see someone who needs help. How can they get in contact with you?
Well, we have a 311 alert, so they can reach out to 311 if they see a homeless client in the street, and we would answer that response or that alert request that they have. Another thing that we do is we work with community board. We go to a lot of community board meetings, and we meet with different people in the community, and we try to have like a partnership as far as working with the community, because they know that their community better than we do. And we can work together about finding clients that might be staying in the building, staying on a roof, because we only look in public places. We don't go inside of private places. So we look for the community to help us with homeless people that we might miss, that might be inside of a building and stuff like that.
311 is the big key. I was going to say yes.
Thank you again, Juan, Sarah, and Isa from BronxWorks Hot Team, the homeless outreach team, for your work and continue work in our borough. Thank you all.
Thank you.
Thank you.
To find out more information about BronxWorks, you can also visit BronxWorks.org or contact J. Rivera at BronxWorks.org for more information on BronxWorks Hot Team. The number is 646-393-4070. That's all for our show today. I'm your host, Sandy Lopez, wishing you and your family safety and wellness now and always. Take care.